Okay, so this is part two of constipation. Who knew we needed 2 videos about constipation? That may be more than you really want. So if constipation 1 was not enough, constipation 2 will more than satisfy what you need to know. I'm Dr. Orcutt, rotator cuff expert. Also look at our private Facebook group that helps hopefully get us all together. So it's not just my knowledge, but it's my knowledge, your experience, me moderating it. So it's helpful for everybody. Also, info at mybodyprotector.com and mybodyprotector.com, where we have additional resources, additional blogs and other things that will help you get through this recovery. Last time we talked about how to prevent constipation, but despite our best efforts, sometimes we still have constipation. So what would we do? Well, being active can be helpful. After shoulder surgery, sometimes it's hard to be active, but if you can begin to walk and move, that'll be helpful. Again, we talked about water is important and fiber is important. So if you can't get enough fiber through your diet, which is 25 to 30 grams of fiber in the day, then you might try a fiber additive. My favorite is Citrusel. Citrusel is my favorite because it doesn't make you feel bloated, it doesn't give you cramps, it doesn't give you gas. So when I have the occasional constipation, too much information probably, I understand, Citrusel is what I prefer for myself. What else could you use? Well, you can do stool softeners. Stool softeners are exactly that. You can do over-the-counter stool softeners like Colace. That just makes, kind of to bulks up the stool a little bit, so it makes it softer, makes it easier to come out. And that's good, but if you're too far along with the constipation, stool softener might not help. You might even start the stool softener after surgery before you get constipated to minimize that risk. We talked a little bit about coffee. Coffee has good oils and good caffeine. If you can take caffeine, that may help you get the stool out. That may help you prevent the constipation, or at least if you have it, to minimize the severity of the constipation. Because obviously constipation can get very severe, so severe you can get impacted. If you get impacted, you go to the emergency room. And no one wants to go to the emergency room after they have shoulder surgery. Before that, no one wants to go to for any reason, but specifically not after you've already had a tough go with the shoulder surgery. The other thing, sugar, alcohol. So there's some sugar alcohols in foods. Typically we see them a lot in protein bars. Protein bars don't have particularly a lot of fiber, so it may not be what you want to be eating after shoulder surgery, but prunes have sugar alcohol. Sugar alcohols actually stimulate a little bit, bring fluid into the gut, and if you have more fluid in the gut, obviously you're taking fluid this way, but also the body can bring fluid into the gut. That can be helpful in managing constipation. Stimulants, again, caffeine is a stimulant, Senna is a stimulant. You can do an over-the-counter Senna that can be helping stimulate. We have to be really careful with stimulants. Stimulants may not be the best thing for everybody, so certainly check with your doctor. And all these things, check with your doctor before you do that. But Senna can be helpful and stimulate like caffeine. The other big thing that I normally use or recommend with my patients, as long as there's no contraindication, as long as there's nothing other things that we worry about that making a bad thing for them, would be magnesium citrate. Magnesium citrate's the same thing. It's a big bottle. You get it over the counter. You drink half the bottle sometimes, or all the bottle, and that magnesium plus the fluid that's in the drink will help, again, keep that fluid in the gut. More fluid in the gut helps you to go. Usually, if you take magnesium citrate, usually within an hour or so you have a bowel movement, so that's beneficial. The other thing is enemas. You have to be really careful with enemas. I would not recommend anybody use an enema unless they check out with their doctor. Enema is actually something you take, whether it's it looks almost like in the pill form, or it's a fluid form, something you stick up your bottom, and that can stimulate. One, it can be just fluid, so it can stimulate with fluid, or sometimes it can be a stimulant itself. Again, I would not recommend doing an enema unless you check with your doctor first, just like all these things. Hopefully, we can prevent it. We can prevent constipation by fiber and fluids, probiotics. If we cannot, then we can help minimize the severity by sugar alcohols like prunes, stool softeners, Senna or magnesium citrate, or even enema. So that's kind of the general gamut of things that you can do to help with getting rid of the constipation. Again, if it gets really severe, if you normally go once a day and you're not going for 3, 4, 5 days in a row, you need to see somebody. You need to see whether it's your primary care doctor, whether you see it's your surgeon, or you see someone in the emergency room, because we don't want this to back up and then having an even bigger problem like some sort of rupture, and that can make you really, really sick. So if you normally go once a day and you haven't gone for several days, don't wait. Talk with your doctor. Don't be embarrassed. This is a very common problem that we have. So if you're having difficulty, let us know, let your doctor know, so we can help you and get through this. I know this is not a really super comfortable content to talk about. That being said, this is a very real problem that we deal with, and so I want to make sure that I'm dealing with real problems, bring you real information, real advice to get you through this tough time in shoulder surgery. And hopefully this is helpful. Again, please like, subscribe, visit our other channels, and we'll see you soon for another video that's probably a little bit more comfortable to talk about. Anyway, thanks again, and we'll talk to you soon.